IV catheter insertion. Step number 1 is to check the patient's chart for the physician's order, patient allergies, any site restrictions, and presence of bleeding disorders. Explain the procedure to the
Good morning.
patient or guardian.
My name is Mujtaba, and I want to insert IV cannula for you to give you a medication. Is it okay for you?
Assemble the equipment needed, which includes the labels, alcohol swabs, gauze, adhesive tape, tourniquet, sterile IV catheter, the prescribed IV solution, and the IV stand. Observe universal precautions. Wash your hands according to the World Health Organization's 12-step guide on how to properly hand wash. Prepare solution with additives if ordered, then label according to policy. Start priming by inserting the tip of the tubing into the bag. Flush the IV line and then clamp. Identify patients correctly. Use their identification tags with their full name and their medical
What's
record
your name?
number.
Maria Cristina Grupa.
Okay.
Select appropriate vein, initially starting with a distal vein. Apply tourniquet 2 to 6 inches above the desired insertion site. Prepare skin thoroughly with an antiseptic swab. Grasp the patient's hand so your thumb is positioned approximately 2 inches from the site. Insert catheter with bevel upwards directly into vein in a 15 to 25 degree angle. Remove tourniquet after obtaining a blood flow back. Realign angle of the catheter closer to the surface of the skin before advancing. Holding stylet in place, slowly advance catheter over needle and remove stylet. Now is the time to collect blood if a blood sample is required. Connect the extension tube. Despite the backflow, flush with 3 to 5 ml normal saline to check proper placement of cannula. You may now securely tape the catheter and tubing. Immobilize the extremity with an arm board and elbow splints only if indicated. Label the site with a gauge number inserted, date and time, your initials, and your ID number. You may now connect the IV tube to the extension. Discard sharps and supplies as appropriate.